Hey everyone, OT Life Hacker here. Week 11 for me. That's right, week 11 in fieldwork, occupational therapy fieldwork. Now, I am going to be giving you my sort of rundown on how from week 1 of my first fieldwork level 2, wherein in occupational therapy, level 2 fieldwork is kind of like an internship or practicum in a sense. So if you, for those who are in business or are in social work or social services or anything that requires an internship or practicum or something that puts together all the information you learned, gives you the practical application of all the knowledge you've gained from your program. That's what this is for us in occupational therapy. And this is, I assume, possibly the same for speech therapy and physical therapy, in that you get your hands-on experience. It might be called something different, but you get the hands-on experience. Now, in acute care, the hospital setting where I'm doing my field work, we have to document. In every profession, every setting, for physical therapy, speech therapy, occupational therapy, respiratory therapy, a lot of different therapies, you know. And ABA therapy, applied behavioral analysis, I'm sure you have to do documentation. In healthcare in general, you have to document, you know, for liability, for knowing what you did with the patient, for communication with other professionals who are going to see that patient. Documentation is critical. It is a must. And so in fieldwork, that's one of the challenges I've had with time management, and also going into the patient's room and knowing that I asked all the questions I need to ask the patient in order to complete my documentation. So what I found helpful, I am going to share right now with you guys this awesome gift that I've come to learn over this period of time, 12 weeks it's taken me to learn this, or well, 11 weeks and ongoing, to learn how to kind of perfect, how to more effectively go do my chart reviews, meaning look through the charts, look through the information for each patient and know what I need to look for, what is important, and also to go into the patient's room and be confident, know what I need to ask, know what I need to observe, and then do the documentation and know that I have all the information I need and not have to go back into the patient's room. So in order to do that, having that piece of paper with me that will guide me, my personal guide for what I need to look at in the charts, what I need to observe when I go to see the patient, what I need to say to the patient, what I need to ask, what assessments I need to do. All of this, I admit I cannot personally process and remember all of this all at once while using that mental flexibility to adapt to the situation I'm in currently and to remember this and that I'm doing with the patient. Nope, not in the beginning, not when I am transitioning to something new. I need to document. That's how I am. I need to have notes for myself so that I am kept on track for everything is ensured, that I covered this, that I did this, that I will be able to document on this in the charts. What I need, I will be telling you guys all about it right now. Let's do it. Alright, so when I first started, I needed to use this for the beginning of the weeks. So here you'll see I spent about 3 hours, 4 hours, dare I say, making this. And this is my way of taking notes, my way of keeping organized for the patient. So again, that I can go into the charts, that I can go see the patient, be confident, be efficient and effective, in that I have everything covered. So what I did was, in each facility, you are going to have a different way of documenting. You are going to have different information that is going to be critical for you to put in your documentation because of the facility's policies, because of insurance, because of what have you that is surrounding that facilities, specific focused on that facilities. So in this facilities, I needed to include treatment time so I can document when I saw the patient, the room number, their age, their weight, the potassium and hemoglobin, because that is important to note. If there's you look in the charts and see that the patient has a drop in their hemoglobin or a really low hemoglobin, then you'll know that, okay, something I have to pay attention, that if they're symptomatic for feeling lightheaded or something, that could be related to the hemoglobin. So it's kind of an indication to you that something might happen during your therapy session, something for you to monitor and look out for. Diagnosis, what did the patient come in here for, and the medical history, why they were admitted, precautions, special alerts, and side equipment. So that can be like a Foley catheter or the IV or something that you have to note so that when the next person comes in, they'll know, okay, I have to be aware that this patient might have a chest tube or some sort of external attachments that I have to set up and prepare. And I've talked about the importance of setup and preparing in another video where I learned a ton of lessons from that one interaction with a patient. Oh my gosh. I say oh my gosh because oh my gosh me. The mistakes you make and the mistakes you learn from. Boy, but you definitely learn as you go. So I'm sharing that in another video. Sure, I'm being vulnerable about my mistakes, guys. So I hope that comes in handy for you. And if you're finding this video helpful, please do like this video and do subscribe to my channel. I have more videos about occupational therapy, what I'm doing in my field work, videos on helping other students interested in going into occupational therapy, giving some guidance. And I would love to know if you guys have more information you want to know about that I can share, that I'd be more than happy to share, because that's why I started this channel. Is when I started off going into occupational therapy and wanting to go into occupational therapy, I had not known about a lot of things and I couldn't really find at the time. Thankfully, there is growing information out there, and I hope that I can be contributing to that growing information for you guys. So do tell me if there is anything else that you want to know that I can share about. I would love to, absolutely love to. And also, on my channel, I am a public health guru because that is what I have my master's in. And so you'll be finding stuff related to health education that's also centered around occupational therapy. And my love for snacks, guys. You'll find that in my videos. I'm exploding of a foodie lover persona because I love snacks, absolutely love snacks. My size may tell you otherwise, but no, I love snacks. Yes, and so you'll find snack videos and product reviews as well on my channel, and the product reviews are more so tailored towards occupational therapy, and the fact that there are adaptive equipment and equipment in general that can help us to better our lives, make things easier for ourselves, sleep-wise and hygiene-wise, all of that. So feel free to check out my channel if that kind of stuff interests you, and hopefully so. There's something on my lip, don't mind that. But I can't touch my face because I'm teaching myself not to touch my face. So I'm sorry if that bothers you guys, but please pay no attention. Okay, so this is all the stuff that I put into here. So we have cognition, and we have pain, gauge, primary device. All of this, I'm just gonna leave it out so you can see for yourself what I have on here. And this is all the information that I initially put. Now on the back, so you can pause the video to see what I wrote here. Upper extremity range of motion for strength, and lower extremity range of motion, all of that. So I put all of that on here, and of course I put the ADL, so activities of daily living, that we need to look at. I put prior level of functioning and current level of functioning. Now, that is a lot. This is a lot to put on a one document, right? So, as I got acclimated to having all of this information ready and available for me, so when I go into the patients, when I look in the charts, I know, okay, I need to know their diagnosis. I need to know their past medical history. I need to know all of this. If the chart doesn't tell me, which it very likely won't tell me all of this, which is the activities of daily living, then I will go into the patient's room and find out all of this information. Clarify, where do they live? Do they live in a one-story or two-story house? Do they have equipment at home? What's their environment like at home? And then look at what is their alertness and orientation and safety awareness, their thinking, their mental status. So I am looking at all of this, and I am assessing, I am asking questions to them to assess all of this. But this was too much to have in one sheet. I started getting boggled down after I got used to it. I knew what information I needed to know. But then I started feeling like, oh, I have to make sure I put it here and here and here. But if you get to know your own process, you don't have to do that. So I had simplified it further through like week 6 for myself. I simplified it so that I have less on my paper because it's all in the noggin. And so on my paper I had put reason for admission, diagnosis, the past medical history, and then precautions. Precautions are number 1. That is what we need to know. What we go into the charts looking for is the precautions. You see the diagnosis, you think, okay, so say for example they have a head injury. Well, do they have any, or better example, say for example they have a cervical fracture. Well, do they have cervical spine precautions, which is, you know, no twisting of the neck, no bending down, no real motion over there, and no lifting heavy stuff. So stuff like that, do they have that precaution? Well, you find out further by looking at special alerts for them. Let's see, bedside equipment, do they have a cervical collar? And also looking at their consultations. Did orthopedics consult them? Did neurosurgery consult? Because maybe that also had something to do with the brain, or if they had an injury there, did they have a concussion? Did they have encephalopathy or any other traumatic brain injuries or brain stuff going on? And then what kind of surgeries did they have? Did they have the neck fixed? Did they have that cervical fracture fixed? And then what were the findings? So stuff like that is really important, because the bottom line for why this documentation is my notes, the reason for all of this is to know my precautions. When I'm doing the chart review, I want all of this information that's here, the diagnosis, the the consultations, the surgeries they've had done. I want all of that to tell me, to lead me down to what precautions do they have. Because when you go into that patient's room, you need to know. And I emphasize this because I've gotten myself in trouble where I go into the patient's room and I don't realize, oh, you're not supposed to, I mean, we don't go to that point because my CI is there with me. But we go to the point of, oh my gosh, I made a mistake. No, we don't necessarily go to the point of safety risk, because the CI is there, is watching me, and he is telling me, what are you supposed to do? Precautions. What is their precaution? And I'm like, ah. So you need to know the precautions. You need to know, is it safe for the person to turn their head? It may not be. If they have a fracture, you may be causing a lot of pain and extra injury to them. You do not want that. Do they have a cervical collar because of that fracture? If they do, you better have that cervical collar on, because otherwise you are going to be in a lot of trouble with the patient, with your workplace, liability-wise, everything. And then I simplified it further, because still, this was too much for one patient, having it all on one paper, I started getting disorganized, having this all in my pocket, and then I'd be pulling out each paper wondering, is this patient, is this that patient? So I simplified it further from myself into the bare essentials, which is the person's identification, so that when I go back to document, I know what patient this is, and then their diagnosis. So you need to know what is the person's diagnosis. I mean, that's pretty important to know. And then you have the precautions, which again, that's my bling bling. That's the major thing that we need to know. And then consults. So after I get all this information, I may write on the back of the sheet what I did with the patient and how the session went, or if I have room, I'll put it here. Now I have 10 per sheet because that's kind of like our number that we need to go for, is 10 patients per day. It's like 10 to 13, but realistically it's kind of like 10. But if we can get to more than that, then woo, yeah, let's do it. So that is why, so I do not have to go through each paper individually and pull out the wrong patient and find that the very patient I'm looking for is always the last patient that I pull out from my sheet, my pockets. Always, guys, always. So that's why I need to have this for myself. And so I hope that this can help inform you guys on maybe even this sheet itself would be helpful for you. And then this sheet later on when you get further into the sessions, or this sheet. But know that it's an ongoing process of learning. And what's best, just as what we learn in occupational therapy, is to get the aids, the external aids that will help you. And for me, it was typing it out. Sure, it took like 4 hours to do this and maybe 5 hours altogether. But it's a well worth it thing because it got me to feel more confident in working with the patient, because I had this external aid to speed up the overall process. So when you have this, you're likely going to speed up your process and your stress levels are going to go down, because you're going to have this aid for you that is going to help reinforce everything for you. And then it becomes like a motor memory for you, in that you know, okay, I got to ask this, got to ask this, got to write this down, got to check this, got to go here and here in the charts, because you'll have a process down for yourself. Alright, so if you like this video, please do like it. Show me that love, guys. Like it and subscribe, please. Hearts all around. Because I would love to know that this is helping you guys. So please do please subscribe if you want to know more about occupational therapy and our student occupational therapy, or for even physical therapy. I think this is very applicable. I've talked to others and they said that this is great. They do it themselves too, physical therapists and speech therapists. So you might find this very helpful for yourself. Alright, talk to you all later. Love you all so much. Bye bye.